Do you have any tips on for our listeners here? How would they select someone that needs that intervention, the neurodynamics, or not?
Most of the patients that come to us with a sensory motor disorder or with pain that we might think it's related to the neural tissues, and many of them are diagnosed with compressive or entrapment neuropathies. So when we think about these neuropathies, if there is a compression of an entrapment, the neural tissues are being entrapped or compressed by neighboring tissues, usually musculoskeletal tissues. I always find very helpful to assess the musculoskeletal system before we do a neurodynamic assessment. Not saying a neurological assessment, which must be previous to the musculoskeletal assessment, but a neurodynamic one should be after you identify that there is or there is not a musculoskeletal issue. So when you ask, when I decide to use a neurodynamic approach, I decide to use it when I find that patient is suitable for that. And what does it mean? It means that I could reproduce during the neurodynamic test totally or partially the patient's original symptoms. And here is a common mistake that people do, is to think that producing symptoms in a neurodynamic test is abnormal. It's completely normal. You are loading the nerves and they respond, and the brain responds kind of a feeling of a threat or a potential harm to the tissues. So it's normal. But the most important thing is to reproduce partially or totally the patient's original symptoms. So then I decide if I can use it or not.